keep these drugs off the streets.
The Oklahoma Bureau of Narcotics says they're seeing a growing problem with people using fentanyl, but they say they're doing everything they can to address the problem. As prescription drugs are getting harder for addicts to find, many are turning to the streets. But some of those pills that look like opioids are really made from a deadly form of fentanyl, sent over here from manufacturers overseas.
A lot of times we will not know that a new drug has hit the streets until we either get a medical report from a hospital or we get an autopsy report.
Mark Woodward, spokesperson for the Oklahoma Bureau of Narcotics, says they have discovered 6 new kinds of fentanyl in autopsy reports in just the last 6 months. They also caught a man in southern Oklahoma using fentanyl to make small pills. They were able to catch him because of a package that came through the post office.
A lot of times they use the drug dogs. The drug dogs can hit on the packages.
Woodward says they work closely with the post office to track whatever is coming into the state. Through this and education, they're hoping to keep these drugs off the streets. In Oklahoma City, Crystal Price, KOCO 5 News.
A new CDC report on opioid deaths shows the powerful painkiller fentanyl was to blame in more than half of opioid overdose deaths in 10 states last year. Now, in October, President Trump declared the opioid crisis a national public health emergency.
I want the American people to know the federal government is aggressively fighting the opioid epidemic on all fronts.
And in November, the White House released its list of more than 50 recommendations on fighting the opioid crisis. They include more training for doctors, penalties for insurers that avoid covering addiction treatment, and more drug courts. The report does not outline a way to pay for any of those recommendations.
I can tell you millions of dollars has been set aside to fight the opioid crisis. Attorney General Jeff Sessions says $59 million of it will help fight drugs that are more dangerous than heroin or meth.
As a result, drugs on the street today are more powerful, more addictive, and more dangerous and deadly than ever. They're so powerful, they put police officers' lives at risk because even exposure to trace amounts can be deadly.
Half of it will help law enforcement agencies develop new programs. Senator James Langford of Oklahoma agrees something needs to be done to combat the epidemic.
So here's what he said in October during a town hall meeting.
The story I hear over and over again from people is they started with prescription opioids, then they couldn't get the quantity they needed, and they went to the street and they bought the fake opioid prescriptions, and they ended up getting heroin because it was even cheaper than the fake pills, and their life was spiraling out of control.
Now, the president's public health emergency order lasts 90 days.
It can be continually renewed until he believes it is no longer needed. Now, here in Oklahoma, we have our own commission focusing on the issue. Attorney General Mike Hunter is in charge. The group has already met 5 times. They are trying to come up with solutions and policies that deal with opioid addiction. Some of the areas they say need improvement are prevention, intervention, treatment, education, and training for law enforcement. The commission hopes to present the legislature with ideas in time for the next session, which starts in February. The Attorney General is also going after opioid manufacturers. They filed a lawsuit in Cleveland County.
And earlier this month, a judge ruled the lawsuit will not be thrown out. KOCO's Brett Bagansky with this story.
The Attorney General's office sees this as a huge victory for Oklahoma. They wanted their day in court. They wanted this to go to trial, and it appears this case is now moving forward. Co-counsel for the state, Michael Burridge, hopes this trial doesn't go on for years. In the state's lawsuit against multiple pharmaceutical companies, the Attorney General alleges drug companies misrepresented and downplayed the risk of opioid addiction, but wanted to increase their opioid sales.
They went in and had an active campaign saying you need to prescribe opioids more. They're not addictive, they're time released, and so forth. That's what happened.
During arguments, the state showed this exhibit, which shows unintentional opioid-related deaths from the late 70s to the present. Lawyers for the state say there's a direct correlation between the company's marketing campaign to the spike in deaths here in Oklahoma and across the country.
The story's not that complicated. What happens is not that complicated.
In Norman, Brett Bagansky, KOCO 5 News.
Mike Hunter is one of more than 40 other AGs asking Congress to repeal a law. The group says the law limits authorities from stopping the flow of illicit drugs. Hunter and the other attorneys general say this is a hurdle in preventing opioid addiction and overdose deaths. The law took effect in April of last year.
Now, a new report is raising some new questions about how opioids are prescribed. The New York Times found insurance companies are still making it easier and less expensive to get the potentially addictive drugs. That's compared to alternatives, which typically don't lead to addiction. Experts say one reason is that opioids are often cheaper. And one of the nation's largest health insurance companies will stop paying for the painkiller OxyContin. Cigna says it's part of an effort to stop opioid abuse. Instead, it will pay for an equivalent drug that could help curtail abuse. This takes effect next year. And last year, Cigna announced a plan to cut customer opioid use by 1/4 by 2019. And Walgreens is the latest pharmacy to stock the life-saving opioid antidote, Narcan. The company says all 8,000 stores will have it available. In nearly every state, customers will be able to buy the nasal spray without a prescription. CVS also sells Narcan over the counter.
CVS is stepping up to help the fight against America's addiction crisis. The drugstore chain says it will limit opioid prescriptions to just 7-day supplies to new patients. CVS also plans to boost funding for addiction programs, counseling, and the safe disposal of the drugs. Pharmacists have also been instructed to call doctors when they see a prescription that offers more medication than the patient might need for recovery. Closer to home, a former cop turned nurse's aide is accused of taking opioids from the hospital where he worked. The Attorney General says Edward Dominic was taking these on camera twice, fentanyl patches from his patients in Enid.
It is clear, based on the evidence, that he stole the patches and converted them to his own use. Whether he used them personally or whether they were sold or bartered is not clear.
Dominic was a former officer in North Enid.
We've been following the Cherokee Nation's attempts to stop the spread of opioid abuse. They're suing major drug companies. KOCO's Crystal Price has a closer look at their fight.
It literally tears families apart.
Cherokee Nation Chief Bill John Baker is talking about the opioid crisis.
These kids that are born addicted, it's hard to talk about.
The Drug Enforcement Administration says more than 2.7 billion milligrams of opioids were distributed in Oklahoma in 2015. Of that, nearly 900 milligrams were sold in 14 counties of the Cherokee Nation.
Pain medications are saturating the Cherokee Nation.
Because of these numbers, the government's Health and Human Services Secretary Tom Price visited Oklahoma to talk about how they're working on fixing this epidemic.
80% of folks who were addicted on opioid got their first opioid through a legitimate, appropriate opioid prescription.
Earlier this year, the Cherokee Nation filed a lawsuit going after major pharmaceutical companies and distributors.
The large pharmacies are greedy and irresponsible.
Price says they've begun rolling out a 5-step program that will address prevention and treatment, overdose reversing drugs,
It's naloxone and Narcan,
analyzing overdose deaths, finding non-addictive pain medications, and looking into how pain is treated.
what can we do to make certain that we're treating it in a way that isn't creating that first path?
We intend to do something about it.
The pharmaceutical companies and drug retailers responded to the tribe's suit with a suit of their own. They claim the tribe has no jurisdiction over their conduct. Crystal Price, KOCO 5 News.
Middle-aged women are more likely to fall victim to opioid abuse.
And this is because they're prescribed opioids more than any other group. A new report says women from ages 40 to 59 also have the highest death rate from opioids among women. Researchers say more people die from prescription opioid overdoses than from heroin overdoses per year. And researchers believe social media could be a new tool to help those recovering from opioid addiction. Officials with the National Institutes of Health and UCLA are studying how to expand peer support networks to social media. The idea to expand the one-on-one attention that patients get at rehab facilities into an entire network that's available 24/7. But there are some risks to this idea.
You know, we often focus on stopping the problem, but tonight we have proof that our our year-long focus on opioid addiction is working. My story focuses on a man who saw my Facebook Live discussion about a Metro group that helps recovering addicts. When Lance Lang and I met a couple of months ago, we were talking about Hope is Alive, a 5-year-old program that opens its doors to men and women coming off of opioid addiction.
We have houses that men and women transition out of treatment centers, correctional facilities, really all across the country, and they come and live with us for a period of a year to 18 months.
About 300 people have been through this program, and when Lance and I went on Facebook that night,
Facebook Live with Paul was absolutely incredible.
Lance and I talked about how people come to live in the houses with others on the same road, and how it's a source of hope and help. People across the country shared our Facebook Live.
In fact, a young man was watching on Facebook Live from Florida.
This young man knew Hope is Alive could help.
He began to chime in and got on our website, put in an application that night, and the very next Tuesday, he checked into our program, and he is still living with us and doing a great job.
He is one of those more than 300 success stories.
That broadcast that night allowed him to find a safe and structured place back in Oklahoma for him to continue to change his life. And without that broadcast, I'm not sure where he'd be today.
It certainly can make a difference.
Yeah, incredible story.
Also, a close call for a precious pup. How a walk nearly turned deadly and what a veterinarian used to save his life.
And get tough on opioid abuse in our state. It's the advice from state officials to the Attorney General, Jeff Sessions. We look at their plan to tackle our state of addiction.
You know, our year-long effort goes beyond tonight's special. We always have a list of resources available on the KOCO app.
And if you or someone you know needs help, look on our app or our website, KOCO.com. We'll be right back.